Good day, everybody. I think we're starting this session now on policing the pandemic and the use of force and violence. My name is Auke van Dijk. I am a strategist with the Dutch police, and I'm a member of the board of the Global Law Enforcement and Public Health Association. And we've got a beautiful session ahead of us with some very prominent and important subjects. We'll start off with the presentation by Suzanne Parker. Suzanne Parker is a doctoral candidate in health policy at the University of Michigan. And her research interest is in gun violence, police and machine learning. And her talk will be on domestic violence injuries during the COVID-19 pandemic. And next to that, we'll have the presentation by Dr. Hanatu Yanada Dimash, who is a physician and public health specialist at the Nigeria Security and Civil Defense Corps. And she's currently a medical officer and epidemiologist and chief superintendent of the course in the Crisis Management Directorate of the Corps. All right. We'll start with the first presentation then by Susan Parker on domestic violence injuries during the COVID-19 pandemic. Talking from personal experience as a Dutch police officer and strategist, we found it really hard to actually pinpoint what happened with domestic violence during the COVID-19. So from the beginning, there were talks about issues around increasing domestic violence, but it was actually very hard to pinpoint. So I'm actually really looking forward to the presentation by Suzanne Parker. Suzanne, please go ahead.
Thank you so much for the kind introduction, as well as some of just the very real personal experience around being in law enforcement during this time. I think that's a really important context that kind of segues well into kind of the crux of our presentation. I'll be presenting on behalf of my two co-authors who are also graduate students. And we're working on understanding domestic violence injuries during the COVID-19 pandemic by using medical claims data. Medical claims data has several attributes that might make it well suited to really understanding injuries at this time. And so we'll talk a bit about the framework, how we're thinking about this, but we really look forward to the experience of those on the ground who are very much dealing with this firsthand. Great. Okay, so just to back out for a second, the motivation for our research is just the huge burden of injury for domestic violence for women who experience it in their lifetime. In the US, that tends to be about 1 in 3 women, but globally it tends to approach, I think, 1 in 4. Social distancing during the pandemic has resulted in an increased amount of time spent with partners. It might also result in economic shocks that might change bargaining within a household. And these stressors may contribute to the incidence of domestic violence, not only potentially cause harm to, I think we often think of women, we also tend to see some of these injuries that might also affect children. Focusing on the US, during some of the existing literature, it tends to show that calls to police about intimate partner violence did increase. We've seen that across several cities. In particular, Leslie and Wilson look at about 15 cities and look at the calls for service. So people were calling the police more for help regarding intimate partner violence during this time frame. But what's not clear is if injuries resulted in physical harm, because we don't really capture that sort of information oftentimes in some of the law enforcement data that's readily available. We observe a call, we don't always even know if the call's coming from the household or if the reporting's coming from other mechanisms. And so we don't really know enough about the characteristics of this violence. And that's where our primary research question and interest is. So our research question is did the increase in domestic violence 911 calls during the COVID-19 pandemic, did it correspond with an increase in violence-related medical visits? Injuries might not be severe enough to warrant medical attention, and so we will miss those. But victims may also, and we will also miss those injuries where victims are afraid to seek medical attention. But at the same time, during this time period, we know that reporting and calling police is influenced by sentiment about police. And during this time frame as well in the US, many protests, many other kind of civil unrest events were occurring. And so that might also influence the propensity to call the police. We've seen that in prior research. And so we think that the medical claims approach might help us understand the nature of the injuries, but it might also provide us with an unbiased sample. If you're injured, there's very little, most studies show that about 15% of domestic violence injuries in the US result in an ER visit. And there's much less choice about being severely injured and going to the hospital or not. There might be more choice in whether or not you call police to be involved, and that sentiment might be changing during this time period. So that's why we're attracted to the claims data as an outcome, which I will talk a little bit about more. And so our next question is, did the pandemic safety policies, what kind of policies really mattered? Was it that mobility decreased? Because we see mobility decreasing leading up to the shutdown orders in the US? Or were there other treatments that we can see, which include school closures or stay-at-home orders? What was really driving some of the what we think is an increase in violence? Is it that school closures cause some of the increases? That's a very different policy prescription than simply a reduction in mobility for understanding what happened with domestic violence and potentially targeting intervention. So I do want to highlight a fantastic resource for this kind of research. The COVID-19 research database is openly available to researchers. It's updated weekly and it contains billions of medical claims. The particular research database that we use contains over 100 million unique patients in the US. And so the sample that we're currently underway completing takes claims data, which is administrative billing data. So anytime a patient presents to an emergency room, a bill is generated. And so we're able to understand what's happening in the medical setting from a lot of this billing data. While we know that violence is underreported in claims data, some providers report it and some don't. And so what we're seeking to do is take the sample of claims and identify which providers are pretty good at reporting violence before the pandemic, and that constitutes what we'll study in our sample. So it won't be the full sample of providers and patients given this underreporting problem, but we do want to make sure we include those patients and providers who do constitute what we've been colloquially calling among our group a good reporter. Some hospitals report violence, some do not. The way that violence is reported on health claims data is through the ICD-10 external cause of injury codes. These codes are international and in nature, and they just document the external causes relating to an injury in particular. And so this corresponds to, we're looking at assault outcomes of female patients. And in the US in particular, these assault outcomes include assaults with firearms, which is an important outcome in the context of potentially increasing US firearm sales. I'll briefly highlight our methodology and just talk a bit about our anticipated policy effects from here on out. I do want to highlight that the literature for a difference in difference methodology, which is what we seek to employ, is moving very rapidly. It's very difficult to compare treated states to untreated states for a variety of reasons. And so we seek to implement some of the new event study methodology which essentially means that we're going to compare a week in 2020 to the exact same week in 2019 to control for seasonality and violence. And so our unit of observation is a facility week year count of female assault injuries that result in this insurance claim at an emergency department. So our reference period is our 2019 facility week data, and we interpret the coefficient on year-over-year change as our outcome of interest. We'll control for state and week fixed effects to kind of wash away the variation that is implicit within states and over time. So what we're hoping to do is understand the effect of stay-at-home orders and school closures, specifically on ER visits. I wish I had a little bit more for you, but the COVID-19 database has been a little bit slower than we anticipated. So it's been very exciting to talk a little bit about how we anticipate pursuing this, and we very much look forward to some of the feedback from those who have very, very applicable real experience dealing with this. Yeah, we thank you very much for your feedback in advance. Thank you.
All right, Susan, thank you very much for your presentation. So I think there might be some time now to ask some questions. So let's see how this works. I think you can raise your hand and you can directly ask your question to Susan. Does anybody want to raise a hand and ask a question? All right. Alternatively, I'm not seeing any hands. So alternatively, put your questions in the chat function. And then towards the end, we've got time to answer the questions. So think about it, put your questions in there. And you can also put your questions during the presentation of Janata, who's going to take the floor now on the role of the Nigeria Security and Civil Defense Corps in the COVID-19 risk communication. Very interesting account of policing the pandemic, I think, and the stressing of the crucial importance of communication and community engagement. And for those of you who don't know that, Nigeria is a massive country. I've never realized that. It's got 200 million inhabitants and a massive police force as well. So that is, interesting in itself, I think. Janata, please, if you could give your presentation. Thank you.
Okay, thank you, Elke, for the beautiful introduction. I'll go right ahead to present my paper. Let me share my screen then. Can you see my screen?
Yes, we can.
All right, so I'll start now. Just as you mentioned at the beginning, I'm a medical epidemiologist with the Nigeria Security and Civil Defense Corps. And I would talk more about the Corps in the course of my presentation because of the diversity I know in the audience that we have, and a lot of people might not really know what's the civil defense and how different it is from other civil defense organizations around the world. So the Presidential Task Force.
So, sorry, Janata, could you try and enlarge your screen, because the picture is pretty small actually.
Oh, okay.
Sorry about that.
Is it better now?
No, it's not. Ah, there we are. This is perfect. Thank you very much.
All right. Okay. So the Presidential Task Force on COVID-19 was established after the pandemic had started. Okay, at that point, it wasn't declared a pandemic yet. So, but there were cases, pockets of cases all around the world. And that was prior to the first case that was recorded in Nigeria. The Presidential Task Force was established by the president of the country. So the main aim of the PTF was to coordinate and oversee all the intergovernmental efforts that were to be put together to fight the pandemic. They had several functional areas ranging from epidemiology, security, logistics, infection prevention and control, and of course, risk communication and community engagement. So prior to that, the Nigeria Center for Disease Control had already established a risk communication technical group, working group, which was already in action like since 2018. So we've been working on that technical working group, and it's culmination and a combination of representatives from different organizations, ministries, departments, agencies, traditional institutions, communication network providers, and all that. In addition to that, just before the pandemic started, the Nigeria Center for Disease Control also launched a Take Responsibility campaign, which was aimed at getting everybody on board to be aware of all the gray areas with regards to COVID-19, and so they could make informed decisions based on the information that they have. So we are part of the security agencies that were part of the technical working group. So I've been talking risk communication, but what is risk communication? It's not just a one-way communication as people might think, but it refers to real-time exchange of information, advice. So it's something that is a two-way thing. The person giving the information is there, the person receiving, and you, the main person or the main official that is giving out the information also takes the opportunity to get some information from the recipient of the main message that is being sent across. So basically it has to do with information and engagement, and then a decision that would be as a result of whatever information, and of course the action that will follow. There are 5 models for risk communication, and the Nigeria Security and Civil Defense Corps has employed all these 5 models for their risk communication activities. So coming to Nigeria Security and Civil Defense Corps, just as I said earlier, just to introduce everyone to what we are or who we are, it's a paramilitary organization that was commissioned by the federal government of Nigeria to provide some measures basically targeted at disaster management. It's empowered by an act that was initially, would I say, passed in 2003, and then later on it was reviewed in 2007. This institution has the power to institute legal proceedings, and also the personnel of the Corps bear arms. So we're kind of similar to the police, but not exactly the police. We have a lot of other functions that we do. Our act enables us to provide warning for civilian populations in times of danger, to assist in decontamination, carrier rescue operations, provision of emergency medical services, and also when there's imminent danger for us to be able to detect and demarcate such areas. So here on the screen, we can see a building collapse where some of our personnel were responding to. We also assist in distribution of emergency supplies. So this is assist because there are other agencies that are lead agencies for some of these assignments. As an overview, the Nigeria Security and Civil Defense Corps has responded to the COVID-19 pandemic in several ways, apart from the risk communication that I'm going to really dwell on. We've been engaged with enforcement of lockdown. That's at the initial stage of the pandemic, and when the government declared lockdown. So we needed to restrict movements of people within the cities and also interstate movements, just so we could limit the spread as at that time. Hand washing and use of face masks was also added to the list of protocols that needed to be adhered to, and we needed to enforce it because not everybody was willing to go ahead. Of course, with our interaction with people, some are claiming, oh, it's just, it's false, there's nothing like COVID-19. So, you know, when somebody does not even believe that such a virus exists or there's really a pandemic, for you to get that person to adhere to some of these protocols was really not easy. So we needed to come into play to enforce some of these things. We provided physical security as well to testing centers, isolation centers, and that was very important because at the isolation centers and treatment centers, there were people that did not believe they had the virus. Of course, they probably did not have symptoms and they were wondering why they should be kept in such places. So some of them were attempting to run back into the communities, but our men were all around such centers to ensure that the patients stay in place. When there was a need to transport logistics from one part of the country to another, and also distribution of palliatives, we provided security. Critical national infrastructure is protection of critical national infrastructure is one of our key mandates. And so we had to rise up to the occasion because of course that period was kind of volatile with the lockdown and people felt the government was just putting them to stay in one place for no reason. So we needed to really provide security for such infrastructure to avoid vandalization and destruction by people. How did the NSCDC get involved with risk communication? At first, we had our personnel that were trained in a group together with other security agencies. And this training was conducted by the Nigeria Center for Disease Control, together with other partners that made up the technical working group. So we had a group that with resource persons and technical personnel that developed these training materials. And so these personnel were all trained. The objective of the training was to prepare these agencies to be able to respond to communication challenges that might arise due to the pandemic, and also to support the response activities. Of course, we did a lot of that. And the issue of stigma, rumors, and all that are some issues that there's no particular agency that would say they will be able to effectively attend to. So we needed to get the security personnel also on board. Our messaging targeted personnel that were going to interact with the general public. We also have VIP details, very important personalities protection details that serve as orderlies that go around with some of the politicians and some of our top officials in the government. So we envisaged that there might be uprisings, of which they were, and so our personnel also are found in such places to control such situations. And so we needed to get all those people trained to be able to know how to relate with people in case of those situations. For security compromised areas, for points of entries, and all these other areas and places, we have our personnel, and we thought it was wise for them to be trained on such, so they could attend to such issues if they arise. So what activities did we really embark on? We were able to embark on sensitization for our own personnel. So we had sessions for the very top officials of the organization where we enlightened them about what the situation was and what they needed to do and what they needed to know. This was in-house. Sometimes we did that on our parades. And this is nationwide because we have commands in all the 36 states plus the FCT. And we have area officers in all the 774 local government areas of Nigeria. So in all these areas, we made sure that the training trickled down to be able to enlighten our own personnel, to make sure that they were brought to we were all on the same page with regards to COVID-19. We had sensitization in public places, markets, banks, schools, examination centers, for all the areas that we felt there was a need and there was high tendency of spread of the virus. We needed to hold our sensitization talks there. to interact with the people, to enlighten them more about the situation and what they needed to do. So the big one for me, it was the sensitization outreaches that we held to some underserved communities, where we had talks, we had interactive sessions, and we were able to make some donations to the donations of commodities to such communities. However, we didn't do only sensitization, but we also had medical outreach attached to it. So the issue of the free medical services attracted the people from the communities to attend our sessions. And while we attended to their medical needs, we took the opportunity to also tell them more about COVID-19 and what they needed to do. Of course, during such talks, we had responses from them, people that did not believe in it, people that felt it was just a conspiracy, or it's the white man's illness, it can never get. So a lot of these responses we had from them, and we were able to address such issues. So we don't work alone, just as we are. I mentioned earlier that we are a part of the technical working group. We collaborate with other agencies, like when the NSCDC, and the national orientation agencies are going to the grassroots, to communities, we work alongside with them, provide security, and also to get the assignment carried out properly. What were the messaging themes that we had? The messaging themes we had were that basically what people need to know about COVID-19, what they have to understand, and what they should share, because it was unfortunate that we could see top officials sending WhatsApp messages and all the forwarded messages, oh, COVID is not real, this, that, conspiracies here and there. So we needed to bring people that we were able to interact with to understand some of these basic things, so that all that could reduce. Issues of social distancing, what to do if they notice symptoms. And of course, we were able to help people understand the proper way for hand washing. So I'm going to share some pictures. This is images from a sensitization outreach that we had in Basa village. It's in the FCT. So we tried to demonstrate proper hand washing. Here we did not have a hand washing station, so we used hand sanitizers, so they could understand that if they are not able to get hand washing running water, they could use sanitizers. And then at the other side, we could see some of our personnel attending to the patients, taking vital signs. So these images are from Ogun State, where personnel of the Corps had to mount and operate hand washing stations in public places, especially at entrances to places, so we could reduce the spread of the virus. As at that time, there was people were not really wearing masks, because the executive order for enforcement of use of masks was not passed as at then. Here we can see the Borno State Government Commandant, Borno State Commandant handing over a pack of masks. So on the table there, we have masks that were customized, looking like our uniforms, so that all our personnel would get masks to use. Then on the right, we have custom-made hand washing station that was made by Lagos State Command. So we have a lot of these that were placed in strategic places within the state and near our offices. This is at Examination Center. So that is the Joint Admissions and Matriculations Board Center, where all secondary school graduates go there, sit for exams, so they could gain admission to tertiary institutions. Our men had to insist on enforced hand washing before entry. This is also like public enlightenment that was used. The one on the left is at the market, and the other one is at the busy street, where sensitization talks were held. So what are the concerns? I mentioned some of them: fear, suspicion, disbelief, poor adherence to hand washing rule because they did not even believe. And then more to that, there were other effects of the pandemic: the issue of economics, the increase in prices of foodstuff, increases in prices of face masks, hand gloves, and hand sanitizers that were very, very cheap initially, became very expensive because of the issue of the pandemic. So there were some things that we noticed and we had to give feedback to the technical working group. First one is the issue of sharing of masks at public places. So if you go to a bank and they say, oh, no mask, no entry, you see somebody coming out of the bank, removing his mask and giving it to his brother or his sister or his friend to wear it. And so we thought, oh, there might be transmission and spread of that virus. So we had to bring this to the notice of the technical working group, which enabled them to generate more messages, because in Nigeria during the pandemic and even now, there are weekly or bi-weekly messages that are generated and sent in as SMS by the network. So this is their own contribution to the fight of the pandemic. Also, we noticed some people go to fit mask. Does it size me? You try it and you drop it with the vendor. So trying it and dropping it, you've dropped, of course, if you're carrying the virus, then that virus might have been deposited on the mask, of which somebody else would come and buy. So what's the way forward? Just as I said, we were able to give feedback to the technical working group, and that actually helped in generating some of these messages to make them appropriate depending on the situation on ground. Rumor management, there were a lot of rumors. We were able to manage most of these rumors at our level, as well as feeding the people at the top to know what exactly to do regarding these rumors. Thank you very much. My presentation. Thank you.
Thank you, Janada, for your wonderful presentation. So does anyone want to ask a question now to Janada? You can raise your hands or put a question in the chat. All right. There we go. There's a question for you, Janada. Can you read it in the chat?
Okay.
Or I can read it out to you. So thank you for your very interesting presentation. So to what extent did you engage with community, religious and opinion leaders in addition to delivering messages directly to the public before proceeding to enforce the measures you mentioned?
Okay, so let me read it. My point is people are sometimes more likely to believe. With regards to, let me quickly respond to this question. With regards to engaging the community, we had our, for us, the security agencies, our targets was basically security compromised areas where other regular personnel wouldn't be able to access. So for such very, very volatile areas, our personnel, together with other security agencies, we were actually able to go right into some of these communities and have community engagement meetings with them. Religious leaders, I would say maybe not exactly, because it's a joint assignment. So we had other agencies. We had other agencies that had specific targets for the risk communication activities. So for some, yes, we did. Some that definitely we knew nobody else would get there. We really put our strength there. Not to say that we did not engage with other groups. For enforcement, of course, it's our assignment and we just had to do it. We just had to find a way of doing it. So whether the people were really much engaged by other organizations or not, when we go for enforcement, we use it as an opportunity to educate them. So we don't just use force, but we try to use that as an opportunity to engage them and to inform them and to respond to some of their concerns. Thank you.
All right, thank you, Janada. Thank you very much for your presentations. And as I've said, I'm sort of in the double role of moderating and trying to give a presentation. I'm going to try and give my presentation right now. Let me see, let me share my screen. Okay, so my presentation will be on policing the pandemic as well, and especially on the difficult relation or stressed relation between public health and the use of force by the police. And it's based on work I've been doing with Gary Gordner and Clifford Shearing. And we asked ourselves the question is, has the recent pandemic changed policing? So the COVID-19 pandemic led to an important involvement of the police in what's clearly a public health crisis. And the question here is whether in essence that is nothing new. The police have always been involved in both crisis and public health, or is policing the pandemic changing the central characteristics of policing? We think the latter. And if there's any merit in these speculations, then the new normals that will undoubtedly follow the pandemic may well include a fundamental shift in our understanding of the police, the way in which the police see themselves, and as a consequence, the way in which they act. So what is our main argument? So we think that the public police has in the course of modernization always been strongly related to the state and the public by reference to public order and the criminal justice system. However, more recent, it is becoming clear that that is becoming a less viable to frame policing in that way. So policing is not best understood as part of a system, and it's not primarily related to public order and crime. The pandemic showed that the police became part of the public health endeavor, and not as part of a new system, but as part of evolving assemblages. And this is, we believe, the character of the new police. So I'll dwell a bit on that. So going back in time, what are the police for? So the traditional view would be the mission of the police is to prevent crime and disorder. And obviously, we soon understood that basically the police is much more of what Morris Pinch called a secret social service. And actually, this conference shows that it's not so secret anymore, right? The police is basically a social service. If we look at last 2 decades, then the number of issues the police got involved in has proliferated. So if we look at high policing and national security, it's about homeland security, transnational crime, natural disasters, or man-made disasters, refugees and immigration, digital and cyber, polarization, radicalization, food security, and so on. And within low policing and community safety and well-being, again, referring to this conference as well, it's about domestic violence, mental health, child exploitation, discrimination and racism, vulnerable populations, substance abuse, and so on. So the question is, at the moment, the classical categorizations and demarcations of what policing is about make less and less sense. And the police get drawn into or are involved in many of society's chronic and emerging problems to the extent actually that they are spread thin. And specifically, which was one of the questions which came up, also related to obviously the protests during the pandemic regarding public health, should the police even be in or should they be out? So what we see now is many attempts in trying to redefine policing, returning to crime fighting as a popular one, order management or tackling harm, or state orders versus problem solving. Is it narrow or broad? Is it a maximalist or a minimalist perspective on policing? And obviously, we need to look beyond the tug of war between policing by control and policing by consent. I'm losing my screen. Just a moment. To have a serious technical problem. I'm so sorry. Okay. Okay, I'm very sorry. My screen is flickering and I'm losing my presentation. I don't know whether you can hear me or not. Someone please confirm.
We can hear you.
Okay, all right.
We're able to see your screen. It currently says redrawing with thin blue line.
Okay, all right. So, okay. So redrawing the thin blue line. I can't see my screen. I'm really sorry about that. I'll try and do it without the screen, and you let me know whether I can actually, change the slides while I go ahead. So redrawing the thin blue line. So we need to think beyond the tug of war between policing by control and policing by consent. But what is this? A theory of everything. So what is the role of policing in that, and what does the pandemic tell us? So quickly around the pandemic. So obviously the pandemic was truly a global crisis, and in response to the pandemic, governments enacted public health laws and regulations, sometimes poorly designed to prevent spiraling mortality rates and related societal costs. And governments turned to the police for enforcing compliance. And in some countries, enforcement led to gross abuse of police powers. And in all countries, it involved limiting individual freedoms. So in many countries, the police were reluctant to take on enforcement roles, referring to potential damaging effect on police-community relations. And we saw on one hand pandemic-related health concerns and widespread and heated Black Lives Matter defund the police and anti-state regulation process. So why was the police brought in? Because they can enforce rules and regulation. Well, if that's the sole reason, you would want the police to do everything. So why not the military? Well, precisely because it is about human behavior. Enforcement can get you only so far. Enforcing social distancing, wearing masks, that is a difficult proposition. So, and the police were right to worry about community relations, and they had to use their discretion to make regulations work, precisely what policing is about. They were not primarily enforcing state orders or at the front end of the criminal justice system, but contributing to solving a public health crisis. Okay.
We are able to see your screen flipping, if that's helpful.
Okay, so what is the slide that is on at the moment?
Sorry, it says why the police right now.
Okay, that's good. And is it now changing?
It did not change.
Maybe now?
No.
Okay. I am very sorry for this. So I'm just going to make my concluding remark, and then I have to give it to someone else to moderate this. So for me, actually, so the pandemic shows that policing is and should not be related to a specific, system. In this case, the criminal justice system, but could be seen as related to the traditional function of policing, returning to the Bittner conception of the use of non-negotiable force, which can be used in many instances, and I have to leave it at that. I'm very sorry. Could you, Susan, could you please take questions and answers if there are any, especially on your presentation and Janeda's presentation? Thank you.
Yeah, of course. Thank you so much for sharing that. We were able to see it. Unfortunately, you were not. One of our participants suggests that perhaps if you're able to stop sharing, that might be helpful. But at this point, I do not see any questions in the chat coming through at the moment.
Okay, I'm trying to stop sharing, but I can't.
Oh no.
I'm so
These
sorry.
things happen. They happen to all of us.
I'm so sorry. So then, if there are no questions, we have to stop strictly on time. Then with every possible apology I can give for this malfunctioning apparently on my side, I would like to thank the presenters. I would like to thank the attendees, and thank you for listening. And again, my sincere apologies for what just happened. Thank you.